Hi everyone, welcome to today's segment. Today's segment is not just about heart disease. It's not about treatment of heart disease necessarily, but it's more about education. What does it mean to have heart disease? How do you live with heart disease? I can't necessarily speak to it. I haven't had heart disease yet, nor have I had to go through stents or angioplasties or bypass surgery and all the things that a heart patient might go through. So I thought it would be important to educate you on that experience. And somebody who's very near, dear, and special to me, Jim Davis, has agreed to share his insights. He's been battling heart disease for over 20 years and has an incredible wealth of knowledge. He's worked with patients over the years to educate them, understand what it means to go through this journey. So today, please welcome Jim. How are you?
Thank you. Glad I could be here to help.
I'm glad you joined us. You know, I know you've been running around teaching patients for a number of years. I've seen you in our hospital walk the floors and talk to patients, and they found it incredibly valuable to gain a lot of those insights. But you've come at this from a very different mindset. This journey started 26 years ago?
Yeah, when I started when I was 11 years old. So it's actually been a little longer than that. But
wow. So explain that. I mean, so at 11, we didn't know as much about heart disease as we do today.
Right.
What was the scare? What did it feel like at that time?
I had a sister who passed away with congenital heart disease when she was only 6 weeks old, and I was 11. And shortly thereafter, my parents got a letter from our school telling my parents that I had, at that time, what was called a heart murmur. Well, needless to say, it actually scared my parents, and before the night was over, I had my first cardiology appointment when I was 11 years old.
That had to be incredibly scary.
Yeah, it was, especially after having lost a family member. It made heart disease a very real thing to all of us. And since then, I guess it was just a question of trying to stay healthy for all those years and do all the right things. But I made up my mind a long time ago that I would manage my heart. I would not allow my heart to manage me. And so at a very young age, I started trying to do all the right things. By the time I was 57, I had already been in the cath lab multiple times and had stents at that point implanted in my heart. And then ultimately had bypass surgery. Triple bypass surgery. I also have had my carotid arteries repaired. I have, at this moment in time, 11 stents in my heart. And I've had a heart attack as well. So I think I bring to the table a little bit of knowledge when it comes to what it's like to be a patient.
Absolutely do. And it's really important for patients to understand and realize that you're not in this journey alone. There are a lot of resources. Yes, the doctors and nurses, we act as your tour guide, so to speak, but we really aren't. It's people like you who really guide that patient through the journey. I can handle the medications, I can handle the plumbing aspect, whether it's stents or bypass surgery, and help patients through those mechanisms. However, there's a huge psychological component, and although I can provide some emotional and psychological support, there's no substitute for insights gained from somebody who's been down that road on multiple occasions.
Right.
How scary was it for you going through some of this?
Well, back when I had my triple bypass, there was no such thing as what I do as a heart ambassador. You had a chance to meet with your cardiothoracic surgeon who explained to you the procedure, and then you were kind of left to just show up for your appointment to have your surgery. It's pretty frightening, actually, because you envision that things are going to change in your life and that you may never go back to normal, whatever normal is for you. And it's a very frightening experience.
Sure. So who answered those questions for you, or did you just learn as time went on?
For me, no one. I always tell everybody that all those things that I described before were literally my on-the-job training, because I guess I've always been very medically savvy. I understand how my body works because this all started when I was 11 years old. So when things were happening to me, I tried to keep as much of a mental note as I could on everything that was going on in the procedure, because by understanding what was going on, it gave me some sense of control.
Right.
It gave me the ability to at least understand what was happening to me. And then that allowed me to make more rational decisions, and it helped me to know what questions to ask. Because many times what I find with patients is they just don't even know how to ask the questions.
Right.
It isn't that they're not interested or they're not afraid. It's just, and part of it is too, they don't want to look like they don't understand. They don't want to sound stupid.
Sure.
And the truth is, there is no such thing as a stupid question. The only stupid question is the one that you don't ask.
Yeah.
And I also constantly remind my patients that there is one advocate in the hospital that's responsible for them, and that is them.
That's correct.
And they need to be able to be comfortable enough with the situation and what's going on to know what questions to ask, so that when the doctor stands next to the bed, they can use that time very efficiently. And when the doctor leaves, they should have some sense of accomplishment from that conversation. Not that they're more confused than they were when the doctor got there. And as a heart ambassador, it gave me the opportunity to many times answer the questions that the doctor either didn't have time or the patient didn't know to ask. And when they suddenly get that vital information, everything changes, because I always tell my patients, knowledge is power. And the more knowledge you have, the more power you have in the process. And by being able to go through it, knowing in the back of your mind when someone says something and they go, oh yeah, I remember, Jim told me about that, it just changes the whole process.
Sure. Any tips for key questions that, like you said, there are patients who are afraid to ask certain questions? Any examples that you can think off the top of your head?
Well, I think the thing that scares everybody the most, and probably what I speak to the longest period of time in my presentation, is if the person wakes up with a breathing tube still in, or the right word is intubated if you are looking for it. Most people are scared to death of that process.
Yeah.
And I can tell you that the good news is only about 40% of people wake up knowing that the breathing tube is even there.
Sure.
Saying it the other way, 60% wake up and they really don't have much of a memory of it. So I find myself in this awkward position of having to tell 100% of the people about what only 40% are going to experience. But I tell everybody that it's a whole lot better to hear it from me and know how to deal with it than it is to go through on-the-job training like I did.
Exactly.
And I was one of those people who woke up with the breathing tube still in and had probably for about 4 hours the experience of living with it in my throat. And so I spend a lot of time explaining to them why they have it, what it's going to feel like, the tricks that they can do to help minimize the discomfort, and to tell them just how quickly it may be gone and what it's going to actually take to remove it. That in itself saves a lot of heartache for a lot of people who go through aortic valve replacement surgery, mitral valve replacement surgery, bypass surgery, which by the word for that, cabbage, in case you hear the word cabbage, they're talking about you, stands for coronary artery bypass grafts. So just like every other thing, I try to tell people about what's going to happen in their emotions after surgery. I try to even tell people how to get out of a chair after surgery because their chest is going to hurt because they have a broken bone in their chest. And just like any other broken bone, it takes 6 weeks to heal. And so in that 6-week time period, I try to give them all the tricks that I can to be able to. You're going to get a pillow of some sort that you can use for coughing when you cough and how to use that properly. There are a myriad of things that we can talk about. And each one of them adds knowledge and each one of them adds power.
This is really a calling for you.
Yeah, it has been.
You've been doing this day in and day out. From what I remember, there were times you were in the hospital at 10 o'clock at night, walking out at midnight because somebody was going to the operating room the next day.
That's true.
You're doing this out of...
A passion for the patients.
Yeah.
That's why I'm sitting here right now.
Yeah.
Is a passion for the patients.
And that's
I wish I had had someone who could have told me before I went through it. And I made up my mind that I would, if I could make it easier for someone else, I would do whatever it took to make that happen.
Yeah. So let's fast forward. You've had your stents, you've had your bypass surgery. How has it affected your life, your lifestyle, I should say? What changes did you have to make? Did you have to make any? And how has that impacted you?
Okay, well, when I had my bypass surgery, I think I was about 210 pounds at that point. Okay, and I'm now tipping the scales at about 170. So, yippee!
Yeah. Congratulations.
How did I do that? I just paid attention to my body.
Yeah. How hard was that?
See, that's one of the things that I try to set patients up for.
Yeah.
All right? They all tell me the same thing when we're in the hospital. They're only going to eat cardboard and drink water for the rest of their life.
Doesn't work.
Because they're never going to go through this again. And I tell them that if you stick to that rule, it's a very short-lived journey.
Yeah.
What I try to tell everybody to do is little steps.
Yeah.
It's the simple things that make a difference. You know, I always tell everybody, if you think you're never going to have a cheeseburger again in your life, that's ridiculous. But if you're about to eat the second cheeseburger, that's the time to ask yourself, do I really need the second cheeseburger? And if you say no, then you do that number one exercise called the push away.
Exactly.
Yeah, push it away. If you do that in time, your body will begin to adjust to the fact that you're not eating as much. So you won't have the sensation of being hungry. And then in time, you can start to add bigger and better things, and that will lead to bigger and better things. Look, I've had all of this stuff done to me. I've had both cardiologists and surgeons say, I can't believe, considering on the amount of stuff that we have done to you, that you're in this good a shape. And that's only because I manage my heart. I try not to eat the wrong things, but I do occasionally. I had a bowl of ice cream last night. You know, I exercise, but I've now tried to incorporate what I do each day as exercise. So maybe rather than driving the tractor around to cut the grass at home, I might use the push mower occasionally for the exercise.
Sure.
It's those simple things. It's not taking an elevator and taking the steps. And it's not, you know, or it's going for a walk with my wife, or just any of those simple things. And I can tell you that I feel fine.
Yeah. And you hit the nail on the head. It's incorporating it into your already
Lifestyle.
present lifestyle.
Exactly.
Right? So one easy way is to just walk 10, 15, 20 minutes after breakfast, lunch, and dinner. Boom. Anywhere from 30 to 60 minutes of exercise, but we can all create 10 to 20 minutes for ourselves.
But if you don't find that that is enjoyable to you,
Right.
try to find the thing that is enjoyable to you and do that in moderation.
Exactly.
Don't get crazy. People start trying to do all of these radical changes after surgery, And the truth is, the more radical they are, the less the chance is that you're going to succeed.
Yeah.
So be simple about
Exactly.
it. And it works.
So at what point did you say, okay, I'm going to start with exercise, morph into dietary changes, and then add in other lifestyle modifications? What was first on your list?
I would say probably my eating. Not that I was ever a poor eater, but I wasn't a smart eater either.
What does that mean?
There are times when you have choices where, I'll use the cheeseburger example, you know? You finish one because you're at a barbecue at someone's house, and you know, you go, boy, I really would like another one of those. And then you go to yourself, well, do I really need that? And you kind of go, no. And then you kind of opt to not do it. And there's a little bell that goes off in your head that goes, ugh, you know, I didn't do the bad thing there. And in time, they become less and less and less.
Right.
And so, and you find yourself eating. Like, if you'd asked me before surgery if I would like a bowl of Brussels sprouts, I probably would have said, there ain't no way. Now I happen to enjoy them.
Exactly.
But did it happen the first night? No. Did it happen the fifth night? Probably still no. But in time, I began to enjoy them. And so that's what I'd try to say.
And that's part of the key, right? Which is give it an opportunity, give it a chance.
Yes.
Don't just turn away
Right.
at it and say, oh, I can never do this. It's all up in here.
Well, I tell everybody that, you know, when I was having my bypass surgery, it took almost 60 years to get there.
Right.
It isn't going to go away in 6 weeks.
That's exactly right.
And so, you know, if I spend the next 60 years trying to perfect that, I'll be around a long time.
Exactly.
That's a good thing.
Exactly.
But if I choose not to do what is right, then all of the things that I went through to get here will have been a waste. And that's, to me, is just not worth it.
And that's so important to realize. You went through these invasive procedures, and if your goal was to not make any changes, and you've brought up a really great point. Why bother going through these things in the first place?
Right.
Because everything's going to shut back down
Right.
or have at least a high risk for shutting down and requiring repeat procedures.
Look, I was born with the genes.
Yeah,
Those things I can't change.
exactly.
But environmental and behavioral things I can.
Absolutely.
And so why not do whatever I can to maximize the amount of time that I have here to spend with my wife and my child and my grandchild?
Absolutely.
It's just that simple.
And I think that's why we do anything
Right.
in life.
Right.
Why do we work?
Right.
Why do we take care of our health? Because we want to be around for our grandchildren
Right.
or great-grandchildren,
Right.
if we're all lucky enough to do so. So, walk me through a normal day for you. What do you do?
Well, I've started a new career, actually.
Oh, really?
About 3 years ago. I restore and repair historic gravestones from the 1600s and the 1700s.
Interesting.
And so I find myself getting a good deal of exercise in the cemetery, lifting stones and working on stones and so on and so forth. So it's kind of become part of my daily activity. I enjoy it. I enjoy the history of it.
Sure.
I've worked on stones from, one of my favorites is a guy named Isaiah Van Sant Williamson. His mother and father are buried at a historical cemetery that I restored. And he was one of the #1 philanthropists in the state of Pennsylvania ever, gave away millions of dollars in the 1800s. And probably every hospital in the city of Philadelphia has been a benefactor of his generosity. And so I find him to be a very fascinating person. So I get up in the morning, generally around 6 or 6:30 in the morning. spend a little time with my granddaughter who lives with us. She gets ready for school. Then I either head off to do a stone or something. I tend to be back at the house by early afternoon. I spend some more time with my granddaughter. One of the things I enjoy doing is picking her up at the bus stop when things are normally at the bus stop, although with COVID now that's not the case. But then we have dinner generally around, early evening. And then I start doing some research on stones I may have worked on that particular day or I'm going to be working on. I try to get a good night's sleep because I know that's important as well. So that old story about 8 hours is a good thing. So I would recommend that people try to get a good night's sleep. And then it usually starts all over the next day. I am a nonstop person. Believe me when I tell you that I try to squeeze 26 hours into a 24-hour day. But at the same time, that's what keeps me going.
Sure.
I'm very lucky to be able to do all the things that I like to do.
Sure. That's fantastic. So have you ever measured how many steps you get in a day?
No, that's a good. I've had one of those little pig things, trying to do that, but I don't know. It's either I forget to turn it off and then I get in the car and it says I did 22 million steps because the car is bouncing. But the truth is, I walk a lot. I did for a long time after my surgery, do the regimented 4 or 5 miles a day kind of thing. But I found that I was spending a lot of time just walking when I could be doing other things that were equally as exercisable. And not feel like I was wasting that time.
Sure.
I did cardiac rehab right after my surgery for about 2 months, if I remember correctly. And I would recommend cardiac rehab to anybody who goes through the surgeries. If you are in heart failure, or if you have had a valve replaced, or if you are having a CABG, go to cardiac rehab. You will be able to exercise with not having to worry about every little feeling that you're having. What was that? I don't remember feeling that before, because someone is monitoring your heart while you're doing your cardiac rehab. And the best thing is, it's really nice to exercise next to somebody who has just been through the same thing as you. So you can take the time to talk about the feelings that you're having, the experiences that you're going through, what actually got you through the surgery and what got you there to begin with. Those are all camaraderie things that you will do with the person or the people in your group, and I highly recommend it.
That's fantastic. So from a food perspective, do you do your own food prep, or how difficult or challenging is it?
For me, it hasn't been a problem, okay? And it hasn't been a problem because in my corporate life, we didn't do breakfast, lunch, dinner. It was always you sort of ate when you were hungry. And, now when I am past that corporate life, I still find myself eating when I get hungry. So for me, it has been more a question of choices when I'm hungry, as opposed to trying to prepare a meal that I would sit down and eat. And I know that works for other people. It just did not work for me. So what I found myself was starting to look at greens different, started looking at vegetables different. Now, it's not unusual to sit down, as I said earlier, with a plate of Brussels sprouts and a salad and some unsweetened iced tea, and that's a very enjoyable meal for me. And I know it's all good stuff, and so for me, it hasn't been an issue. And exercise was always kind of a part of what I did, so it wasn't an issue for me either. Except for the fact that I was, like I said, about 210 pounds when I had my CABG. I was in reasonably good shape.
So you really just made like you said, smart choices, less of some things,
Yes.
reduced some of your red meat intake.
I don't eat red meat at all now.
Okay.
Did I before? Yes. Have I had a cheeseburger between my cabbage and now? Yes. If I sat down and there was a steak sitting on the table, I wouldn't eat it.
Yeah.
And it's just because I now don't want to.
Right.
I'll take the bowl of Brussels sprouts and I'll leave the steak. It's just me.
Yeah.
But that happened over time. It doesn't happen overnight.
Exactly. And that's, I think, the key point here is it takes time to achieve all of these things.
Right.
Don't expect to happen overnight.
Right.
These are voluntary choices that you get to make.
Right.
Whether you choose to or not is entirely up to you.
Right. There's nobody standing there going, don't do that. You have to have that little angel on one shoulder and the devil
And the
on
other
the other who's saying to you, I don't know if I would eat that right now.
Exactly.
You know?
Exactly.
And when this guy's going, just eat it, you got to go, because
Flick 'em off. Yes.
it's not the smart thing to do.
Right. And it's a very slippery slope.
Yes.
Because once you let it go once or twice,
Right.
you're more likely to
Yes.
keep going
I've
down
never
that.
understood that about the human psyche. Why is it that we have such difficulty doing all the right things and such ease doing all the wrong things?
Because
It's God's joke.
it's a pleasure-related issue. Exactly. It's all up in here. It's the dopamine effect, which we're hearing so much about
Yes.
these days. So, any last words of wisdom or from
I'd
your
like to talk
experience?
for a little bit about the emotional side of
Yes,
what happens
please.
from surgery.
I think that's very important.
Because everybody thinks that it isn't going to bother them, but it will. It may be just a bump in the road, and it may be a very life-changing situation for you, but you're going to experience some form of emotional backlash from any kind of surgery that you go through. There are a few things that I would like to recommend that you do. The first is, there will be an email address, I'm sure, here, and if you really want to talk to me, please feel happy or free to do so. The second thing that I recommend that you do is talk to the people that are around you. They're not going to understand what you're talking about because they haven't been through the surgery like we have. But they are friendly ears, and they're willing to listen to what it is that you have to say because they care about you. And sometimes by just talking about it and you hearing it from yourself, it makes you feel a lot better about the process. And the last thing is that if you don't want to talk to somebody, and some people don't like to do that, I would like you to sit down with a piece of paper and a pencil. And whoever your favorite nurse is or your favorite doctor is, sit down and write a letter to them explaining to them how you feel about what you just went through. Whether you send it to them or not is not really important. But what it does do is it gives you the opportunity in the privacy of your own mind to sit down and explain to yourself how you feel about what you just went through. And then when you get done the letter, here's the hard part. I would like you to either read the letter to someone that you care about, or I would like you to read the letter out loud to yourself. Believe me when I tell you that those words will become real. I'm getting emotional now talking to you about my own experience, and so I know what it feels like. If you take the time to do this, I promise you that most of those negative thoughts and experiences will begin to subside, and over time, they'll become less and less. But you need to be proactive. Don't just wait for them to go away. Try to do what you can to manage those feelings.
It's incredibly powerful.
Yes.
Thank you for sharing.
You're welcome.
So Jim, before we come to a close, your passion has clearly driven you to do something really unique and special, which I haven't seen anywhere. You've participated and created a 4-part video series.
Yes, which basically takes everybody through the process from pre-op to post-op. It literally tells you what's going to happen when you're in surgery. It tells you what's going to happen when you're waking up and how you're going to feel. And it deals with all the issues when you go home. So you can watch any of those and get much more detail than what we have just taken a few minutes to touch on. And I would encourage people to do it. It will help them. And if don't remember every single detail, it will be in the back of their mind. And when something happens to them, they're going to go, oh yeah, I remember Jim said that. So.
No, and that's exactly right. I couldn't have said it better myself. I've watched the 4-part series, and it's been fantastic.
Thank you.
As a patient, it gave me a much better insight into what a patient might go through, right, what they might be feeling. And so you, as the viewer, I would encourage you to visit those websites and review all 4 of those videos, especially if you have surgery coming up, or maybe you have a loved one who's going to be going through this. But again, thank you, Jim, for joining us today.
You're welcome. It was my pleasure.
Same. It was a pleasure having you. Thanks, everyone, for joining us today. Look for more of our informative streaming episodes here on this channel. See you soon.